Welcome to Doctory Channel. Today, we're focusing on a crucial topic that impacts women worldwide, cervical cancer. We'll explore what causes it, how it can be prevented, and the latest treatment options. Stay tuned to learn how regular screenings and vaccines can make a significant difference. Don't forget to subscribe for more health insights. Let's dive right in. Do you know what cervical cancer is and how it can be prevented? Cervical cancer was once a prominent cause of cancer death among American women, but thanks to increased awareness and preventive measures, the death rate has significantly dropped. Cervical cancer begins in the cells of the cervix, the lower part of the uterus that connects to the vagina. The majority of cervical cancer cases are caused by various strains of the human papillomavirus or HPV, a sexually transmitted infection. It is a disease that can touch any woman, regardless of her age, background, or lifestyle. The fight against cervical cancer is an ongoing battle. But with continued awareness, education, and preventive measures like the PAP test and HPV vaccine, we have powerful weapons at our disposal. Understanding cervical cancer is the first step towards prevention. Several factors can increase your risk of developing cervical cancer. The most significant is an infection with the human papillomavirus or HPV. This sexually transmitted infection is behind most cervical cancer cases. If you smoke, your risk effectively doubles, meaning that women who light up are twice as likely to get cervical cancer compared to those who don't. Another risk factor is a weakened immune system. Women with conditions like HIV, which suppress the immune system, are at a higher risk. Finally, long-term use of oral contraceptives can also slightly increase the risk. Studies have shown that extended use of these birth control pills might be linked to a small uptick in the likelihood of developing this type of cancer. But remember, understanding these risk factors is only the first step. Awareness of these risk factors can help you take preventive measures. Cervical cancer often doesn't cause symptoms in its early stages. However, as the disease progresses, some signs may begin to emerge. One of the most common symptoms is abnormal vaginal bleeding. This could occur after intercourse, in between regular menstrual periods, or for some women, after menopause. Another symptom to be aware of is unusual vaginal discharge. It might be watery, bloody, heavy, and could potentially have a foul odor. This is your body's way of signaling that something isn't quite right. Lastly, pelvic pain or discomfort during intercourse can also be a symptom of cervical cancer. Any persistent pain in the pelvic area that's not related to your menstrual cycle is worth discussing with your healthcare provider. These symptoms don't necessarily mean you have cervical cancer, but they should not be ignored. Regular checkups can help detect any abnormalities early. And remember, recognizing these symptoms can lead to early detection and treatment. Prevention and early detection are crucial in the fight against cervical cancer. One of the most effective measures is getting vaccinated against HPV. The HPV vaccine prevents infection from high-risk HPV types that are responsible for most cervical cancers. It's recommended for both boys and girls and is most effective when given at a young age, before any exposure to HPV. Next, we have regular PAP tests. These can detect precancerous conditions of the cervix, which can be treated to prevent the development of cervical cancer. It's recommended that women start getting PAP tests at the age of 21 and continue every 3 years. Lastly, quitting smoking can significantly lower the risk of cervical and other cancers. Smoking exposes the body to harmful chemicals that can lead to cancer. So, kicking the habit is not only good for your lungs, but your overall health. Taking these preventive measures can significantly reduce your risk of developing cervical cancer. The treatment for cervical cancer depends on several factors, including the stage of the cancer. Let's explore the common treatment options. First, there's surgery, which can range from simple procedures that remove abnormal cells to more extensive operations that remove the cervix or other parts of the reproductive system. This is often an option for early-stage cervical cancer. Radiation therapy is another common treatment, often used as a primary treatment or in conjunction with surgery. This can involve external beam radiation or brachytherapy, which is internal radiation. Then, there's chemotherapy. This is typically used in combination with radiation therapy for more advanced stages of cervical cancer, or alone if the cancer has spread to other areas. These treatments may sound daunting, but remember, the medical community has made significant strides in managing and treating this disease. Early detection and treatment can significantly improve the outlook for women with cervical cancer. Thanks for watching our discussion on cervical cancer here at Doctory. Remember, early detection through regular screenings and getting vaccinated against HPV can be life-saving. For more information and updates on health topics like this, make sure to subscribe to our channel and hit the bell icon. Stay informed, stay healthy, and see you in the next video.